I'm Mark Zinni. This morning on CT21, where is Connecticut falling short when it comes to COVID? And what's driving the increase in cases? The state's acting commissioner of public health will join us with some insight. How are Connecticut's teachers feeling about the return to school with the uncertainties about the pandemic? We will find out. Plus, Congresswoman Jahana Hayes joins us to talk about going back to school, what Connecticut gains from the infrastructure bill being debated in D.C., and what she has to say about running for Congress again. It's all this Sunday morning, August 8th. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford Healthcare.
Good Sunday morning, everybody. I'm Mark Zinni. Eric Parker is off this morning. Last week, every one of Connecticut's 8 counties landed in the orange zone. That's the CDC's color designation that shows the areas of the country showing a substantial spread of COVID. And that is not where we want to be right now. The Delta variant is very much here, and it's very much a problem. Joining us this morning to talk more about what needs to be done to get us out of the orange zone is Dr. Deirdre Gifford, the acting commissioner of the Connecticut Department of Public Health. Dr. Gifford, thank you very much for being here with us this morning.
You're welcome. Thanks for having me on, Mark.
Well, you certainly know this better than we do, but we are moving in the wrong direction right now, are we not? I would imagine you're pretty concerned about the fact that the positivity rate is climbing back up.
Well, we have seen more cases definitely in the last month in Connecticut. And as you indicated, we've seen our rates go from low transmission to what the CDC calls substantial. That just means there's a certain number of cases per population in that county. But the good news is that because of our high vaccination rate, particularly in older individuals, Connecticut continues to be one of the lowest states in the country when it comes to cases, hospitalizations, and deaths. But we do, as you indicated, need to take some actions to turn this around. This is what viruses do. They mutate when there's lots of opportunity for them to be spreading infection. And the way that we can stop this trend is, as we've been saying, through vaccination. So that's what we're focused on right now.
I know there have been some poor choices made by a lot of people, perhaps getting together. The Department of Health spoke in the past few days about some events that led to these outbreaks. Are people still making bad decisions around all of this?
Well, you know, the reason that we put out that release this week about the party and the summer camp is just to raise awareness a little bit, because when the CDC changed their masking guidance in May and indicated that vaccinated individuals could stop using a mask, I think a lot of people maybe took that advice a little further than it was intended. And so what we saw here in Connecticut, for example, was there was a fairly large social gathering, started outdoors, and then moved indoors for a pretty long period of time. And it included a mix of vaccinated and unvaccinated individuals. But everyone, I think, took off their mask. And by the way, I want to say to all of the people that attended that party, thank you, because they were tremendously helpful to the Department of Public Health in talking about the events, and it was super helpful for us to have the ability to speak to them. What we learned there is that if you were vaccinated, you were far less likely to catch COVID, but some people that were vaccinated did. So 33 people there were 6 cases among the 33 vaccinated individuals, but 10 cases among the 13 unvaccinated. So you were 4 times as likely to catch COVID if you were unvaccinated at that event. So the message is, if you're going indoors, you have a mix of vaccinated and unvaccinated people, wear the mask.
And the vaccine obviously is really the key here, as you've been talking about for a very long time. But with the vaccine, I think people thought, okay, I won't need the mask anymore. So there's perhaps this level of frustration right now with people being told to put the mask back on. Do you understand where people are coming from with that?
Absolutely. And, you know, I think everyone's real tired after a long 15 months of COVID. But, you know, the virus is tough. It's a tough virus. And as I mentioned, It will find ways to find people who are susceptible to infection. So we have to be as tough as the virus. And that means that even if you're vaccinated for a little while longer, put that mask on when you go indoors, and that's going to protect you, but it's also going to protect unvaccinated people and others who may be vaccinated but not have as strong of an immune response.
You mentioned being as tough as the virus, and the Hartford Courant did an editorial a few days ago talking about if the state is doing enough right now. You know, is it time to maybe really enforce perhaps another lockdown or take some pretty drastic steps to really bring this thing under control?
You know, the governor has said this week that this is a very different circumstance to where we were a year ago or 14 months ago. We have one of the highest vaccination rates in the country. Over 80% of our adults in Connecticut are vaccinated now, have had at least one dose. That's tremendous. So it is a much different situation than where we were a year ago. We still have work to do to get everyone vaccinated. And the good news there, Mark, is that for the last 3 weeks, we have seen our numbers of vaccination go up every single week. So people are starting to realize that this Delta variant needs to be taken seriously. And then, you know, we think that people will generally follow the recommendation to wear a mask. When I've been out and about, I'm seeing lots and lots of people indoors wearing a mask again. And so I think that people are doing the right thing.
Before we let you go, obviously you want people to get vaccinated, but briefly, will the testing continue for free, and is that still key to getting this under control?
Absolutely. There are hundreds of places around the state to get tested. We're also looking at whether the state needs to start adding any testing capacity to places where there are outbreaks, and you should not be charged for a test if you have symptoms or if your doctor orders it or if you're there for the screening.
Dr. Gifford, thank you very much for joining us this morning. We appreciate it.
You're welcome. Thanks for having us on.